The COVID-19 virus is causing a ripple effect of uncertainty throughout the world. We're all working towards one common goal: to survive. And as a result of our survival mode, we're doing some remarkable things that we normally wouldn't. Let's start with these 4 extraordinary things that I've observed during this COVID-19 crisis. Number 1, culture of care. Many companies are providing flexible work options to help people care for themselves and others. Number 2, behavioral changes. Frequently washing hands, not shaking hands, using hand sanitizer, and not touching our faces is becoming normal. And even though these behavior changes are difficult, we're learning that it can be done. Number 3, leadership. Leaders are keeping people informed, they're adopting new strategies, and very much involved in creating the culture of care that I mentioned earlier. In many cases, by taking adequate precautions themselves, they're modeling the behavior that they want to see in their employees. Number 4, urgency. There's a sense of urgency that's developed around people taking care of themselves and others. These 4 things are prominent because the risk of COVID-19 is very visible and in many cases could be fatal. Once we move past this immediate threat, however, and resume normal life, how could we learn from these 4 behaviors to deal with risks that perhaps aren't as visible but are still quite high? For example, the threat of burnout, the threat of disengagement at work, the threat of compromised mental health, or the inability to deal with stress. These threats and their associated risks to our well-being are real. Up to 85% of the global workforce is partially disengaged at work. Stress at work is increasing. Depression is on the rise in many professions, and many corporate environments have become synonymous with long-term high-pressure work. Here's how the 4 extraordinary behaviors that I mentioned before can help counter these threats and why we should continue them even after COVID-19. Number 1, culture of care. During normal times, work environments should continue to be adaptable and flexible. Policies for people to maintain realistic work expectations, including time to recover at work and outside of work, is crucial for a healthy workforce. Number 2, behavioral changes. This is a good opportunity to evaluate other well-being behaviors we can start once the COVID-19 threat is over. For example, we can decide to relax and do nothing for a certain period during the day, or invest our energy on something that's important to us outside of work. Number 3, leadership. Leaders should continue to model their caring behavior even after the COVID-19 threat is over, and show that they continue to care about their employees in all situations. Number 4, urgency. Better work environments where the focus is not just on the work, but also on the individual is a matter of urgency, and we should train to become proactive. Organizations with a culture of caring for the individuals and not just the work, where well-being behaviors are promoted, where leaders model desired behavior, and where there is a true sense of urgency to create thriving environments, are those that not only survive in trying times, but thrive. Because what creates extraordinary environments isn't just caring for others when times are bad, but doing so when times are good, and when the threat isn't as visible. Let's commit to becoming extraordinary.